Hi, I'm Peter DeNoble, orthopedic surgeon at Modern Orthopedics of New Jersey. Today, we're discussing distal biceps tears, which are common injuries that we see and treat in our practice. Distal biceps tears can be very painful when they happen, and they can cause weakness to flexion of the elbow and to rotation of the forearm. In this video, I'll guide you through the causes, symptoms, and treatment options of this problem. If you're dealing with symptoms potentially related to a distal biceps tear, this video is for you. So what's a distal biceps tear? When we tear our distal biceps, the connection between the biceps muscle, which is that muscle when we make a muscle that you see right here, it's connected to the forearm. And so you lose the ability to powerfully turn your palm up, and also you lose a little bit of strength in elbow flexion. Now, when it first happens, a distal biceps tear can cause swelling, bruising, and a lot of pain. And so a lot of patients who come into our practice typically will have those symptoms along with the weakness symptoms. So what are some common causes of a distal biceps tear? Well, the best way to think about this is that the force has to overwhelm the strength of the connection of the tendon to the bone. When this happens, oftentimes I'll see patients who maybe they were helping a friend move and they had a couch on one end and it was almost too heavy and they went and lifted, and all of a sudden there's a little bit of extra force and it goes whoosh, and it just overwhelms the strength of that connection. And all of a sudden they hear a pop or may feel a pop. They'll actually also see their biceps retract up the arm, and you may even see like almost like a little divot in the front part of the upper arm. And so that's the first sign or symptom of a distal biceps tear. Some additional common causes of distal biceps ruptures are things like accidents where you're slipping and falling and going to try to catch yourself on a countertop, or maybe you fall off a bike. These sort of things are instances where there's an overwhelming amount of force that goes right onto your biceps when you go to grab something and you feel that pop. So what are the common symptoms of a distal biceps tear? Very commonly, you'll have immediate swelling, pain, and you probably will also have felt a pop in the area of the elbow. When you look at your elbow, not only will it be swollen, painful, but you also may not feel that biceps tendon, which you normally can feel in the front of your elbow. So how do we diagnose biceps tears? When I see patients in the office with a potential for a distal biceps tear, I also start with a history, understanding what ended up happening that led to this. And a lot of times it's that same sort of story, which is an eccentric, powerful contracture, swelling, bruising in the front of the elbow, weakness to flexion of the elbow, and also supination, turning the palm up. On physical exam, what I end up looking for is, we call this the hook test. Now, the hook test is something where you can literally stick your finger right behind an intact bicep and kind of grab it. You can even do it on yourself and kind of note that, okay, that biceps is intact. You can feel that tendon kind of doing its thing. When we go to get that finger underneath the biceps and it's not there, that was something we call a positive hook test. Now, another common thing that we'll do when we suspect a distal biceps tear is to get an MRI. Now, even if I'm almost 100% sure that you popped your distal biceps and it's retracted, I want to know how far away that tendon is. For preoperative planning purposes, I want to know how far I have to think about coming up to find that tendon. Is it coiled all the way up into the arm? Is it torn but kind of hanging out close to where it's inserted? And that can vary from patient to patient. So what are the different options to treat a distal biceps tear? There's non-operative and operative options. The non-operative option is essentially just letting the swelling resolve, getting back to the function that you can, understanding that you're going to have less strength to flexion and a lot less strength to rotating your palm upward or supination. Now, that for some patients is totally appropriate. Maybe they're not able to undergo an operation or just don't feel like they want an operation. I would say the vast majority of my patients who come in with this problem, a distal biceps tear, do often want to get back to full strength. And so that is going to be an operative option. Okay, so when we decide to proceed with surgery, here's how it goes. Now, in our practice, we use minimally invasive single incision techniques. What that entails is an incision right on the front of the elbow that's about 3 centimeters long. That allows us access to go grasp the tendon, secure it, and put it back into the bone to allow for restoration of flexion and supination strength. We put absorbable sutures into the skin and allow you to, right away after surgery, begin the process of regaining your motion. So you had a distal biceps repair. What does your recovery look like? All my patients engage in some form of formalized physical therapy. And that's really important to make sure early on that you get all your range of motion back for flexion extension, pronation, supination, and start working on strength, which usually starts around the 1 month mark. Now it's kind of like a staircase. We start light weights and then bring you up slowly week by week. And usually by about 3 months, you're doing really, really well. Now for the highest end of force on your distal biceps, things like pull-ups or rowing or something that really kind of is like a heavy weight on your arm, I usually will be a little bit more conservative, make sure that we really wait for that strong healing to happen, tendon to bone healing, by about 6 months. If you think you've sustained a distal biceps rupture, come on into Modern Orthopedics. We'd be happy to evaluate you and see what the next best steps in treatment are.